Hello, everyone. This is Dr. Simran Shaik. I'm a practicing homeopath at Usher Clinic and a student in MD Medicine from Nashik, India. Today, I am here to be a part of the celebration of the 8th anniversary of Global GHK, such a great platform for all the doctors as well as GHK practitioners to come together and share their learnings for the betterment of society and for the betterment of health and medicine all around the world. So, I am extremely grateful to be a part of this community of learners and educators. So yeah, let's go ahead. I'll be sharing my screen. So today I am dealing with one of the most complicated organ system according to modern medicine, but we will try to simplify it because our mentors have tried their level best to simplify it for us and educate us on this system. So once again, welcome to the 8th anniversary celebration of Global GHK. A disclaimer you all can go through, please. Gratitude to our stalwarts in this, that is Dr. Hahnemann, which is father of homeopathy, and Dr. Gerd Hammer, who is the reason why we are here today learning about GHK and learning about all the things that he has compiled together and taught us. So let's begin. The heart and the circulatory system, right? So the first slide says it all. The greatest mystery of all is the human heart, because whenever we come across pathologies of the heart, they are either very shocking to the family. They come at times where everything is very acute, very fast, action has to be taken immediately. Everybody gets really scared whenever there is a heart pathology involved, right? Even in our practice in clinics, whenever we have any heart pathology coming, it comes with a lot of distress to the clinic. Everybody surrounding the person also is in a lot of panic, and they are questioning because it becomes a life and death situation. So there are n numerous pathologies of the heart, and when I was going through this and when I was learning this system through GHK, what I've realized is Dr. Hammer has tried his level best to make sure that every pathology of heart is covered and made us understand the depth of what it can be, like what the organ system actually works as, what is the biological conflict, and what is the biological system running behind this. So I think that is what we are going to go into. Before I begin, though, like I said, that this is a very complicated organ system, and because of that, it is vast, right? It is vast. There is so much to learn. There is heart, there is circulatory system, there are different layers, everything has a different conflict. So this would just be an overview. If you want to learn more in depth, I have another case. You can join Global GHK, and we have sent cases over there, and we'll always be coming up with new cases and new understanding of this organ system. So this would be just an overview for you all to know that, where you can start from. So first of all, we need to know the embryology of the heart. So it's just a very plain and simple slide. The heart tube. So when the heart is formed, right? This is the heart tube which is formed. Truncus arteriosus, bulbus cordis, ventricle, atrium, and sinus venosus. So these are the primitive parts of the heart. Now, when this tube, which is a cylindrical tube, is twisted and turned in ways to form the structure of the heart that we know of as today, right? So there is this video you all can see, which is very important, I feel.
In the development, the primitive heart develops as two tubes that merge into one tube. The single tube begins to swell and develop into various anatomic features of the heart. The heart begins to beat by week 3. In normal cardiac development, the cardiac tube will twist and turn on itself in a rightward direction. This is called dextral looping. This results in the right ventricle developing on the right side of the heart and the left ventricle developing on the left.
Okay. So what I want you all to know here is that the twisting part is very important, right? Which is the looping of the heart that they had just showed. Why is this important? So let's look at why we had to see this video and why is this so important.
In the development, in the
right? So now, as you saw, that it was a single tube which was twisted in a direction, because of which the principle of laterality that we know in GHK and GNM, that is, uh, we are very clear about it, that in a right-handed person, the right side belongs to your father, your work, and your partner, and your left side belongs to your mother, your children, and your siblings. But as the heart tubes are twisted, the principle of laterality is reversed. So whenever we consider pathologies of heart, especially the myocardium and the ventricles, the right and the left laterality theory absolutely reverses. So here, a right-handed person, when we are talking about, the concern would be a mother-child related overwhelmed conflict with right myocardium. If the conflict is associated with a partner, then it will be with the left myocardium, and similarly, vice versa, the left side, right? So we learn about this, but you just have to remember the theory of laterality that we know of. In case of heart, the ventricle, myocardium, etc., the laterality principle is reversed. Then, according to modern medicine, we know that the layers of the heart, there are three layers: myocardium, endocardium, and pericardium. Myocardium is the more muscular layer, pericardium is the outer layer, and endocardium is the inner layer. So now I think let's learn with the case, because I think the best example or the best way of learning anything is when we learn through a case, so that we know what is the pathology, what are the symptoms the patient gets to us. So presenting complaint. So the patient came to us with a history of complaint of CCF on 19 to 2022. This was the year that they have had these complaints since. Now symptoms, what were the symptoms? There was dyspnea, that is difficulty in breathing. There was chest heaviness, which was there on and off. There was chest palpitation. So there was, there was little flutters of the heart, or they would feel palpitations in the heart. That usually used to happen during stress, the patient had narrated. And there was fatigue and tiredness on exertion. The patient has been on diabetic medicines since 2020. The urine frequency is there at right, so the patient has to get up at night to urinate 2 to 3 times in a day also, and at night also. That is basically a night thing. Past history, like I said, diabetes mellitus, the patient has had since 2020, and he had a history of dengue in 2019. Now, this is the report that he got to us in March 2022, right? So, if you see that there is dilated cardiomyopathy, mild mitral. So, please note that the patient had gone through, this is a female patient. The patient has gone through a heart attack. And there were symptoms of the heart attack. The patient was then taken for treatment. The treatment was done, and this was the report that they removed. And after that, for treatment, they came to us in the OPD, right? So this is a female patient. I forgot to mention that. So dilated cardiomyopathy, mild mitral regurgitation, mild left ventricle dysfunction. LVEF is 45 to 50%. Fair RV function, mild diastolic dysfunction, mild dilatation of the left ventricle, and no pulmonary hypertension. So when we look at this report, we understand that there is something wrong with the left ventricle, right? It is going into dysfunction. The LVEF is also getting low, and there is dilation of the ventricle. With that, there is cardiac myopathy. And of course, if there is a pathological change, there is going to be pulmonary hypertension or some kind of hypertension linked with it. So the BP rises, hypertension as in, right? So now what could be the conflict here, right? We are going to go through heart superficially right now, but we need to know the conflicts. That is the basic thing that we need to know when we are studying any pathology of the heart. So what could be the conflict here? So that we will study on as we move through the PPT, right? Now let's see, of course, we consider because we have read it, we have considered the conflict. We are talking about the ventricles. So we have considered the conflict. And then we are going to go to this place where we are confirming with the patient that what actually happened in the life, right? So the patient said that they were severely stressed since 2020 due to the household matter. So something in the household was going wrong, or there was disturbances or stress factor. Now, what were they? So November 2021, what happened was her son-in-law had expired. And it came as an untimely shock to the family. Son-in-law, so the daughter's husband had expired. She was really worried about her daughter and her daughter's future, that now the husband is no more. There were no children involved yet, but the husband is no more. So how, what will her daughter do? So she obviously, as a mother, she was very stressed for her daughter. And moreover, what had happened was the daughter's in-laws told the daughter to go back to her maternal place. So they were like, I mean, the husband was no more, they were suffering through it. So they told the daughter that you go back to your maternal place. So here people live with their in-laws in India, right? So that was the situation. And since 2020, her husband has also had issue of memory loss. There are a lot of symptoms. The husband has had these issues. So in all of this, what was happening was that even when she faced the heart attack, the one time when she faced and she went to the doctor, even during that phase, she did not inform her son. So she also has a son who's studying outside. She did not even tell him in the, even when the patient had come to us for the first time, there she had not told this or not shared this incident with her son. And at the same time, when she was suffering and the husband was in the house, but she was like, I don't, she did not even feel the need to disturb her husband. So she was going through that suffering without even informing family members, right? And then later on, when they found her and if they took her and all of that, she was later on conscious also. She did not call out for help to her husband too. Now she feels, at the moment, what is the feeling? That now she feels helpless due to the situation of the daughter and the husband, and doesn't know what she can do better for them. So for the daughter also there is helplessness, because what can she do, right? The son-in-law has expired. So what best can she do? The in-laws have sent her back. And for the husband also there is cares and worries of his health, of his memory issue, and all of that is going on. Her life revolves around her family, and to take good care of them is what was in the case, right? Now, in this, the most prominent part was that she said that in our language, she said that amala dhakkach basla. As in, said she was shocked with this incident, right? Because the son-in-law was absolutely fine, there were no problems. So it came as a big shock to their family. So in homeopathic medicine, that is, we had taken the rubrics. If you all are aware about this, this was the rubrics. And in homeopathy, we had prescribed the medicine of Ignatia Amara 200, 3 doses. And of course, we knew the conflict. We knew what the patient was going through, what was the conflict that was setting in. So we have counseled the patient that this is the reason that is making you sad. You need to bring the awareness and you need to manage this conflict now, right? Which is the conflict resolution that we know of in GHK. So this was the final prescription. 3 doses were given. And this was the follow-up. So the follow-up, next report, of course, we have been in follow-up with her for a long period of time. It is a heart complaint. She's been on medications. And this is the 20th November 2024. We had her reports done again. So if you see, it is a follow-up case of dilated cardiomyopathy, moderate mitral regurgitation, fair global left ventricular dysfunction. LVEF is 50 to 55%. So that has definitely improved. RV function is good. Mild diastolic dysfunction is there. No pulmonary hypertension. That has absolutely, the hypertension that problems was there is gone. And all cardiac chambers seem normal size. So if you see in the previous report, we had dilatation of ventricle, dilatation of, there was regurgitation also, and there was hypertension also. So this is definitely a improved report, and all her symptoms, as in her fatigueness, weakness, dyspnea, palpitations, everything had reduced after the medicines for sure in these 2 years, right? So this was the case that we have studied. Now moving on to how, cardiac pathologies are something that even in our OPDs, and as like I said, it is something that we really get scared of. So the whole purpose of taking this case and the whole purpose of diving into this system, this organ system, is to know that it is possible, with the correct knowledge of GHK, with the correct application of homeopathic medicine. I think dealing with cardiac cases is definitely possible, and we will be able to understand these cases better, right? So what did we do in this case, and what was the conflict that we considered? So according to GHK, now I'm going into the theory part of it. So first, let's see what was in her case, right? So myocardium, ventricular heart muscle. This was the layer which was involved in our case, like I said. So when we talk about the ventricular heart muscle, myocardium is the muscular middle layer of the wall of the heart, and has excitable tissue and the conducting system. Now this is according to modern medicine. So we know that the myocardium, which is ventricular heart muscle, is derived from the new mesoderm and is controlled from the cerebral medulla. Now, when we talk about ventricular heart muscle, there are two control centers in the cerebrum. One is the cerebral medulla and the other is the motor cortex. Now, cerebral medulla will work and control the tropic functions of the muscle, so the nutrition of the tissues of the heart, right? And the motor cortex deals with the contraction muscle of the heart and the ventricular conducting system. So the SA node, AV node, the heartbeats, all are controlled over here, right? What is the conflict? So, the biological conflict linked to the ventricular myocardium is an overwhelmed conflict, right? The conflict is always in reference to a person or people, whether the right or the left myocardium is affected is determined by the person's handedness. This we know. Now, what is this overwhelmed conflict, right? Overwhelm is an emotion which is very intense or hard to deal with. It affects you very strongly. Here it is related to negative stress load. So overwhelm, when does a person feel overwhelmed? When there is a situation in your life which is too much to take. I mean, it's like there is so much stress and this has to be a negative stress, right? You cannot be like positively overwhelmed and going into so much of pathology. Overwhelming, it can happen. So this negative overwhelming is basically when there is a pressure on your mind, or there is some incidents that is happening around you that puts you in a negative stress, which is getting overloaded. Like this I am not able to take, this is my, the level at which I can take the stress, and now this stress that has come has absolutely crossed the boundary and it is a overload. Now this much stress is an absolute overload and I cannot take. That is the overwhelmed feeling. Example, an overwhelming workload is associated with a demanding boss or with an unsupportive core worker. Anyway, so the basically what I'm trying to explain over here is that in our case, the overwhelming situation and the overwhelming things came around with the loss of the son-in-law and the pressure that the family members of the daughter, the in-laws of the daughter, were giving them. It came to them as a shock that this is a negative overload, this is extremely, she did not, it was an absolutely untimely death of the son-in-law, and over that the in-laws are sending back my daughter back home. Now what will happen to my daughter? Why are they acting this way? She was really surprised with the way the in-laws had in a week sent the daughter back home. So that was the negative stress overload in our case. Now, what happens in conflict active phase here, right? So, like I said, that there are two areas of the heart. There are two things happening during conflict active phase. The first is cell loss, where the heart muscle goes into necrosis, right? And the second, where the motor part is involved, there is paralysis of the heart muscles. So, the contraction, the ventricular conduction system all gets affected in the conflict active phase because of the overwhelming conflict. If the conflict persists, the thin myocardial wall might rupture with blood flowing into the pericardium, which can be pericardial effusion, right? A myocardial perforation could also occur during the epileptoid crisis. We know about the epileptoid crisis, which is the peak of the healing phase. With lasting conflict activity, the heart muscle becomes weak and shows symptoms like physical weakness, difficulty while climbing stairs, difficulty in walking short distances, right? These are the symptoms that a CCF patient anyway brings to us. And these are the symptoms that were present with our patient also. Reduced ability of the heart to carry sufficient amount of blood into the body's circulatory system is called myocardial or cardiac insufficiency, right? These are the terms that the modern medicine uses. But why? Why is this insufficient? This is the explanation to it. Then there is the healing phase, which is coming in, right? So in the healing phase, what happens is during the first part of the healing phase, there is necrosis of the necrosis of the heart muscle. So there has been cell loss that we saw, right? Now that cell loss will be replenished in the healing phase through cell proliferation. What is the term we know about this as myocardial sarcoma? And in this situation, in this healing phase, if there is an inflammation coming in, then the condition is called myocarditis. Okay. Then in the healing phase as well. So whenever we talk about the recurring healing phases due to the continual conflict relapses, there is enlargement of the heart. This was also present in our patient, right? constant physical exertion, for example, sports. Huh. So now we know that this is caused by the conflict, right? There is a conflict set in, it has gone through conflict active phase, that has gone through healing phase. But if the conflict is relapsing again and again and again and again, of course, the tissue conflict, the cell loss, cell loss, cell proliferation, all of this leads to an enlarged size of the heart. But Dr. Hammer has also stated that even if there is not a mental conflict directly, but there is constant physical exertion and in sports, etc., etc., it can also lead to an overwhelmed conflict, because that is also something that you're doing too much, right? And that can also affect your heart in some way or the other. And yes. Now we will talk about myocardial heart attack. So again, I am telling you, I have taken this topic before, the ventricular system, before in our GHK lectures, which you can go and view and join us. It has been in detail. It has been in more detail about this particular layer, and it's going to be coming. This is like, pick a small grain in a whole bag of rice. That is how much knowledge is available and has been made available to us by Dr. Hammer. So, myocardial heart attack, I'm trying to explain. So, what we know of myocardial heart attack is, one second, I think I'll take that slide first. That when we talk in what we know about myocardial heart attack is that it is only of one type. It happens due to acute myocardial infarction. That is what is a heart attack, right? We know that there is a due to high cholesterol or all these risk factors, there is a plaque formed, and that plaque can displace, embolism, thrombosis, and then there is a block and there is an infarction. So there is less blood available. But there are majority of evidences that shows that myocardial heart attack has also occurred in people where the cholesterol levels are normal, the coronary artery are not obstructed, and still we believe that it is to occur due to infarction and coronary artery obstruction. But Dr. Hammer has given us the explanation that why it can happen without this. Definitely, a plaque or a coronary artery obstruction can cause heart attack. But what are the other ways that the heart attack can occur, right? It can also occur due to the conflict setting in into the ventricle, which is a muscle of the heart, the myocardium, right? So again, myocardial heart attack always comes during the epileptoid crisis. So we know that the conflict sets in. It is a conflict active phase. There is healing phase, part one, part two. That there's edema and water release. But if there is a relapse, then we go into this epileptoid crisis. And at the height of the epileptoid crisis, a person goes through myocardial in heart attack. That is what we need to know here. So the brain edema, because there is swelling, right? In the healing phase, we know that there is swell. Is accompanied by swelling. The edema later on is expelled through a sympathetic surge. So what is this? This is the sympathetic. This is your sympathetic, and this is your parasympathetic activity. So due to this, in this healing phase, that whatever edema is there is to be expelled around the brain. So it goes into a sympathetic surge. And due to the sympathetic surge, there is a period when the myocardial heart attack occurs, like I said, at the height of the epileptoid crisis. The myocardial infarction is initiated in the brain. That is what we need to understand. Controlled from the motor cortex, the myocardial attack manifests itself as contraction of the heart muscle with painful cramps. That is why the patient goes through so much of cramp, which can be termed as heart epilepsy. Right? This we have understood. So that is what is GNM and GHK answering, that based on the science of GNM, the myocardium and the coronary arteries originate from different embryonic germ layers, are controlled from different areas of the brain, are linked to different biological conflicts, and the cause therefore depends in the different regions of the heart. And not just this, because it is different and the symptoms are different, understanding the symptoms, we can also understand what type of heart attack is it. Is it a coronary artery obstruction? Is it happening due to the myocardium, ventricular muscle contraction at the height of the epileptoid crisis? That also can be learned in through the knowledge of GHK. So there is so in, like I said in the lecture that I have taken before, I have also explained the right ventricular heart attack and the left ventricular heart attack, and how do they differ and how do the symptoms differ. So I would request you all to please go and join Global GHK and view. right? So this was what was in our case, right? This is what we have considered. The overwhelmed conflict is what we have considered, and because of the pathology developing in the ventricles, the rest of the symptoms have gone like a sequelae, one after the other, and it has formed what the patient was suffering with. Now let's talk about, like I said, I'm going to give you all an overview about the other parts also. So now we are going to talk about myocardium, which is the atrial heart muscle. Similar layer, but now we were previously talking about the ventricle. Now we're going to talk about the atrial heart muscle, right? So again, derived from the endoderm and controlled by the midbrain, right? So, what is the conflict for atrial heart muscle? The biological conflict linked to the atria of the myocardium is not being able to move the blood. The conflict linked to the atrial myocardium relates to the biological distress that the heart is unable to manage the blood flow and to supply the organism with sufficient amount of blood. Right? The conflict is usually brought on by a diagnosis such as your blood flow is poor or your arteries are blocked or the scare of a heart attack or stroke. So there are so many times where we do cholesterol reports and lipid profiles, and there is, once the cholesterol is high, everybody, no, even if you're not a medico, the cholesterol being high, it is linked to the heart so much in the media, in the oil brands and everything, that we know that, oh my God, if the cholesterol is high, it's going to be problematic to my heart. Even that fear, that is what GHK is trying to explain, that even that fear that, there is something wrong with my blood flow, or there has been a previous heart attack, or there is some pathology linked to the heart, can also trigger this conflict even more, right? Taking blood thinners can keep the conflict alive, of course, because you know that you are going through an area where you're not able to move the blood. The body is not moving the blood. So I need to do things that the circulation of the blood is good, right? Now we just go through this in short. Like I said, derived from the endoderm, organs controlled by the midbrain, not being able to move the morsel. This you don't have to take into consideration. This is the midbrain. This is the conflict, right? Not being able to move the morsel. So the morsel in this case is the blood. There is, in conflict active phase, there is hypertony of atrial muscles because, again, midbrain, right? We know about this. And in healing phase, wherever there is hypertony of the muscles happening, that returns back to the muscle tension, returns back to normal. So this is what we need to understand when it comes to midbrain. Midbrain and brainstem are two different parts. Their functions go around different. That is what we also know in uterus. So please make sure that you are reading the knowledge of, if you all are interested, of course, you all are reading the knowledge of GHK in depth to understand. Sorry, right? Now let's talk about the middle layer, which is the endocardium, as well as the heart valves. Now, whenever we hear of mitral regurgitation, sufficiency, flutters, etc., these are all valves. Like we know the valves. The aortic valve is present over here, the tricuspid valve, the mitral valve, and the pulmonary valve, right? Along with the endocardium. So, derived again from the new mesoderm and controlled by the cerebral medulla. What is the biological conflict? So the biological conflict linked to the endocardium and the heart valves is a self-devaluation conflict. But self-devaluation conflict, we know, can be bones, can be, other systems. But what we need to understand is self-devaluation conflict related or associated, especially with the heart. So what is this? In practice, we usually observe this as the persistent angina pectoris. So if you get that pain, you are getting that pain for a long time. Heart arrhythmias, a previous heart attack that has occurred in the patient. There could also be a family history of cardiac insufficiency. So this thought, that someone in my family has had some cardiac problem. So am I going to suffer from that also? It is also a sort of self-devaluation that is my heart weak too? Is my heart not being able to pump too? That again comes as a self-devaluation you are putting for your own heart. A doctor saying lines like your heart is weak or there are some issues with your cardiac or circulatory health, which brings a negative thought in the patient's health. Very similar, very linked to, but we need to, if you want to like exactly pick the pathology and pick the conflict and ask the patient what has happened, then this could be a great tool. Again, in short, derived from the new mesoderm, organs controlled by the cerebral medulla. The self-devaluation comes in, but associated with the heart. In conflict active phase, again, there is going to be cell loss, necrosis happening, which will be in the healing phase replenished with the new cells. Okay. Moving ahead, there is pericardium. Okay, so pericardium is the last layer of the heart that I'm going to be dealing with. Now, pericardium derived from the old mesoderm and controlled from the cerebellum, right? Pericardium consists of the outer layer of the heart. The biological conflict linked to the pericardium is an attack conflict. Now, attack conflict also we know corium skin, something said to us, so affecting our skin. But here, the attack conflict is linked, it is attack conflict, but it can be linked to specific attacks coming again in your heart. Now, what Dr. Hammer has said is a punch or a blow or a physical attack that has come towards your chest and has given you an attack can also develop an attack conflict, right? So, an attack against the heart is experienced, for instance, through a stab or a blow against the heart or through a push in the upper body, especially in a fighting incident. But also, it can be sharp word. Means in Hindi we have a line कि मेरे दिल को लग गई वो बात. मतलब क्या कि इतना बुरा बोला कि मेरे दिल को लग गया. दिल को लग गया is they said such bad things to me that the insults and the verbal assault was so much that it came and directly hit my heart. It directly, came to my heart and I took it to heart. That is what we say, right? So those are the things that it is like a cut to the heart, like something that is so that is said and it is so bad that we are really, really, really bothered by it. So that is the attack conflicts against the heart, and that's when your pericardium gets affected. So this can again be a diagnosis of a heart disease or comments of physician that your heart is not working properly. All of this can also come as an attack towards the heart, right? Your blood pressure is too high, etc. can also evoke a fear, like if you go to a physician. And with this, because it is very, so the thing is, the pathologies of heart are very interlinked because if heart is one organ and it is very interconnected, right? So it's not necessary that you'll have only one conflict running. Now, with this, there could also be a self-devaluation similarly running, and that is why your valves will also be affected in that case, right? Now, even when we are considering heart attack or we are considering ventricular, there can be two, three conflicts simultaneously running. But when we are asking question and posing question and counseling the patient, that is when these differences can come into play. The conflict can also be experienced with or in behalf of someone else. Let's say when a loved one has suffered an heart attack. Yes, this can also be. And this is like a note to know, right? Now, again, just covering up in short, old mesoderm, of course, derived from organs controlled by cerebellum. Attack conflict here against the heart. In conflict active phase, there is cell proliferation because cerebellum. And in healing phase, there is going to be the cell removal of the extra cells, right? So this we have understood. So thank you. I had considered this and I had taken 30 minutes for my lecture, and I have taken this one case. There is another case already explained by me before in the context of heart, but I wanted to give an overview of all the layers of the heart once so that we are very clear with it. But yes, thank you so much for giving me this platform. I hope the understanding is somewhat clear about the system, the cardiac system, and this is only a start of the learnings. We are going to come with much more details. We are going to come up with circulatory system, different pathologies of heart, which layer is affected, which conflict can come into place, and because of which we'll be able to treat these things much, much better. So I just want to say thank you to the entire team of Usher Clinic, all the doctors that have helped gather the information, Dr. Asher Sheikh, Dr. Reina Sheikh, and all the assistant doctors at Usher Clinic. And we work together as a team and we come up with cases and explanations for all of this. And I hope that we would be a part of the GHK for a very long time, and the learning and the teaching will only continue. So this was my lecture. If there is any doubts, of course, you all can reach out to me and we will definitely be coming up with many more sessions like this. Thank you so much.